that. Welcome everyone, once again to the Care Forum. I'm going to make a few announcements and then introduce our speakers. And our first announcement is going to answer Anne's question. Hi, Anne. I haven't met you, but you called. This is Professor Anne. And so the first question is, when is Avenues returning? We are having a slow walk to our return in September. Just pay attention to our email blasts. We will be announcing our reopening. We're going to reopen a few classes in July for those of you who are pre-registered, and Tracy McLeod, our participant services director, is handling that. I will continue to run my caregiver group by Zoom, meet with clients, and start to meet with people privately, individually. So we're having a slow reopening because we want to be safe and we want all of our protocols and policies among our staff and when people enter our building to be consistent and uniform. So now moving on to the Care Forum. The Care Forum began in 2019 and at the grace and benefit of an anonymous donor who then helped reboot for the post-pandemic period before we, quote, return to normal. So we want to thank our donor for her efforts. And I want to ask all of you to pay attention to your emails because we'll be sending out a survey, and your response to the survey is critically important to us because it helps us continue to obtain funding for these special lecture series and also helps us plan to meet your needs as to what is most helpful to you. So in this survey, I am asking you, it's coming from me, if you want these events to continue by Zoom, or if you're willing to meet in person with other caregivers in a room that may have 20 to 40 to 50 people. Because all of us starting to talk about how safe we feel as a family caregiver, caring for a loved one, what it is and how we're going to navigate our futures and where we're going to be and where we feel safe. So I'm asking you really for your, to answer our survey, but every single question on the survey has space for comments. So please take time, make your comments, don't rush through it, and it's going to come back to me. Okay, so introductions, my favorite part. So Dr. Ellen Brown is the former medical director of Pathways and has spent many, many years in our community helping to develop and grow programs addressing end-of-life care, helping families have difficult conversations, and she is continuing to provide private consultations. Dr. Rita Ghatak, I met in the hallways at Stanford Hospital when she's director of Aging and Adult Services, and she is now the founder of a private consulting firm called Aging 101. Are you 101, Rita? Yeah, okay. So they have been working together for almost 2 years now on Care Forum topics and concepts. And each time we do these, we really try to tailor them to the needs of our local community. So thank you. And I'm going to go off screen and mute, and then I'll come back at various points.
I think we are waiting for Kat to start the slideshow.
Oh, okay. Sorry about that. See, there we are. Can you see that okay?
Right.
Perfect.
You know, I do have one more thing I want to bring up because I don't want to wait till the end. I want to, while everybody's on, and that's our schedule change. Okay, so I'll do it very quickly. So I'm going to ask all of you to note that July is canceled because Rita and Ellen have family obligations, but the August and September sessions are the same. So if you've pre-registered, that's fine, or you can continue to register. And then we're going to do the session that was scheduled for July at the end. We're going to do that in October. And that last session is on discharge planning. So it sort of works thematically for our last session. Okay, we're now ready to go.
Great. Thank you so much, Paula. Welcome to the third session of the Care Forum 2021 We are so grateful to the Avenida's management team once again. And as always, Paula, you and Kat for your help. Dr. Ellen Brown and I have worked extensively over the years with caregivers, with families and families coping with dementia. Personally, I have spent decades in the developing protocols for dementia care. And I recognize the many, many aspects to managing care for those diagnosed with dementia. Added to that, the challenges faced by caregivers vary since there are so many different manifestations, personality, functioning, and yes, dementia is the global term for all the changes in function and behavior. And though there are a few kinds of dementias, Alzheimer's disease is one of the most we see. Ellen?
Rita, I want to both second the thanks to Avenidas, Paula, and Kat, as well as the welcome to all the participants in this session. We're going to be delving into a very important area, and I'm just really glad to be back with you, Rita, to doing this third care forum. As Rita mentioned, dementia in the US is a huge problem. There are about 10 million people diagnosed with dementia and 50 million in the world. And as Rita mentioned, Alzheimer's is the most common, with about 6 million in the US. In our last session, we talked about how important caregivers were to the healthcare system. And today we want to focus specifically on the difficulties caregivers face when their loved one or the care recipient has dementia. We also want to highlight how much more difficult caregiving was during the pandemic. And we are also going to briefly address the hot topic of aducanumab at the end of the talk. This drug was recently approved for the treatment of Alzheimer's and is all over the news, but we will save that for the end. Next slide, please.
Our first objective, to recognize the unique features of caring for someone with dementia during the pandemic and how isolation accentuated some of the difficulties.
Secondly, we hope you will learn strategies for improved care of the care recipient in order to alleviate caregiver burden.
Learn about tips and strategies for preserving brain health. There have been few very important national initiatives regarding brain health. The 2018 to the 2023 CDC Brain Health Roadmap outlines how communities, state and local public health agencies and their partners continue to promote cognitive health. This is really new and state of the art. Addressing cognitive impairments for those living in the community and helping caregivers. We will share some of these tips with you. Next slide, please.
The COVID-19 pandemic posed such unique risks to those with Alzheimer's disease and dementia. Research from 2020 showed that these people have a relatively high risk of contracting severe COVID-19. Plus, we're at risk for disturbances as a result of all the lockdown measures and social isolation. Now, Alzheimer's disease per se and dementia don't increase the risk of COVID-19 in and of themselves, but is the dementia-related behaviors that Rita will go into that increase the risk of contracting the infection. And once infected, people with dementia had much more severe outcomes than people without dementia.
Ellen, you're so right. I remember all the calls through the pandemic. Cognitive impairment and the associated personality, psychological changes makes it so challenging for individuals to understand and comply with the changes during COVID, such as forgetting to wash hands, not being able to hug people, kiss each other, safeguarding the procedures like wearing masks, maintaining appropriate physical distancing. All of these were so hard to explain to our patients.
And caregivers were also severely impacted. Dementia care was hard enough, but now with the inability sometimes to spend time with your loved one or intervene with health providers or be present with a health provider visit, stress reactions were increased. In addition, adult day health programs, senior centers, which provided really necessary respite, and with their closures and with reduced neighborhood resources, caregivers were responsible for care 24 hours a day. Next slide, please.
So we want to take a few minutes and look at just comparing caregivers, the ones dealing with dementia and the non-dementia disorders. Ellen, I often share the quote, which is available on your slide in front of you. Remember, the dementia patient is not giving you a hard time. The dementia patient is having a hard time. And I think it's so important to step back and think about that. The neurochemical changes in the brain, the lack of memory, which honestly is our reference point, the decline in judgment, decision-making, changes in personality and behavior, all of these add to great challenges for the care recipient. And of course, the caregiver. These changes in the care recipient impose, I believe, an almost continuous and serious impact on the caregiver. Many studies show caregivers of those with dementia have much higher levels of burden than other caregivers.
Rita, we also know that compared to caregivers of care recipients without dementia, caregivers of care recipients with dementia have increased depression. Studies show the prevalence of clinically significant depression in these caregivers can range from 28% to as high as 55%. Depression in care recipients with dementia, as well as their caregivers, is under-recognized, underreported, and undertreated. And this leads to great impact on employment complications, caregiver strain, mental and physical health problems, less time for leisure with other family members, and increased family conflict. Next slide, please.
I think that, Ellen, it's so important to share with our audience the range of the care recipient issues that emerge and are there, and that really impact caregivers. And you and I always believe the more we understand what we are faced with, the better we will deal with that. So as these changes emerge, so does the caregiver's response and level of concern. We would like to share a few noted issues that impact caregivers the most, and all of these have been studied extensively by researchers.
And we want to just start basically with just physical function, the day-to-day activities that you're dealing with. There may be impaired walking or gait, difficulty with personal hygiene, toileting, oral care, sundowning behaviors at night, decision-making, the financial issues that caregivers may need to take on, the vast number of medical appointments and medications taken a number of times throughout the day, and caregivers have to take on these responsibilities as well.
The behavioral problems, they are so significant, and you can see that on the slide is listed as number 3. As these changes happen, the safety issues emerge, and the level of care needed often causes caregivers to have to make so many complex decisions. Should I start to get part-time care? When and how to hire? Full-time care, we know how expensive these are. Eventually, thoughts of placement. Each of these areas, as they emerge, cause a different level of concern. Finally, and this is something Ellen and I talk about a lot, and it happens in my practice on a daily basis, when a care recipient with dementia enters the emergency room or a hospital, it is always a challenge. We tell our caregivers, inform about the diagnosis to staff at every step, all the way to discharge. Ellen, let's look at a few tips and recommendations that we can provide. Next slide, please. So much like physical health, Ellen, cognitive health can be viewed along a continuum, from optimal functioning to mild cognitive impairment to severe dementia. Most of the caregivers that I work with are those who are coping with dementia, and I have noted with my decades of work in this is that each journey is different. And I think that is so important to recognize. The stage of the disease, whether it's the beginning, the middle, or the final, or the severe, how the care recipient is functioning, what are the triggers, what are the care needs, the ways the caregiver has to shift and balance their own life and needs. So we have to look at each of these journeys. And the first step is always identify what the areas are in front of you. And my personal tip is always creating a customized care plan. What works for one caregiver and a care recipient may not work for another. And I cannot emphasize, Ellen, how important this step is. Spending a little time on this really helps creating a roadmap. Caregivers can get quickly overwhelmed, but just to take the time to create a plan, and this involves knowledge, what to expect, knowing the resources around you, like I said, a roadmap, what happens at each stage, etc. There is also another factor, Ellen, which is ways of accepting, managing, recognizing the disorder, modifying the environment. We always start with this important self-assessment piece, and we spoke about this in the previous session. I am often told by caregivers that fewer than half of the dementia caregivers are ever asked by a health provider about their needs. So for that reason, Ellen and I are providing the well-known Zarit burden scale, which is used by some health providers to just assess the burden. We will share with you just to have a perspective and self-assessment. But we always start with knowledge, right, Ellen?
Yeah, Rita, yes, we know that knowledge is power. It helps caregivers lessen their stress by planning, by setting realistic expectations. And what I mean by knowledge is to what to expect as the dementia progresses. What are treatment options? What are management strategies that can all help lessen the stress? It's important to have conversations with health providers of you and your care recipient to learn about managing difficult behaviors, identifying the problem, gathering strength and tips, and whether the tips come from health providers or even support groups where people are sharing information as well. But opening yourself up to solutions can all be helpful. So it's been shown that support groups, especially, I mean, I know we have active ones here, and many people on this call participate in Avanitas's support groups, all to help lessen stress and help provide solution. But both Rita and I want to stress, as soon as you recognize changes in your loved one, it's important to bring it to the attention of the health provider to help get a diagnosis and start creating these individualized treatment plans that Rita's talking about. It's been estimated that many people wait 4 to 5 years before a diagnosis, before bringing this to the attention of a health provider and before a diagnosis is made.
The final point is, building this network of care. I cannot tell you how important that is. And it works for caregivers who are dealing with a care recipient, maybe in a far away or a different state, just starting with the support network. And this can be the physician, the health providers, the neighbors, family. Many caregivers find it very difficult to talk about the diagnosis and hide the symptoms and the diagnosis of the care recipient from immediate family and friends. This makes care for the care recipient even harder. So talking through some of these barriers is so important. Of course, a wonderful tip that Paula always mentions is seeking these links with the service partners in our community. I know some of these have lessened during the pandemic, but there are still a host of services, care at home, so many aspects that you need to seek help: transportation, legal, financial, nutrition, etc.
A health provider can make a referral for counseling, adult daycare, respite care, adult day health. And it's been shown that caregivers are much more likely to follow through with a doctor's referral or recommendation if they actually write the order on a prescription pad. We also recommend the Alzheimer's Association that offers a 24/7 support line, plus consultation, education, their own support groups, Family Caregiver Alliance, and a few others, all listed on a resource sheet that we're going to be providing to all the participants on this session. Next slide, please. There are many, actually, if you can go back to the last slide, sorry about that. There are many practical suggestions for tips on the day-to-day challenges. And many of you on this session probably have your own that you've discovered work for you and your loved one. Usually it involved lots of trial and error. The resource packet I mentioned includes many online resources on managing some of the difficult symptoms, the financial and legal challenges as well.
And there are a host of medications that we often talk about that could be used, and there is a category of the antidepressants, the anti-anxiety, the antipsychotic medications that are sometimes provided to care recipients. But these, Ellen, as you know better, needs to be weighed so carefully by the clinician, the neurologist, the psychiatrist. Very important to have oversight regarding medications overall. All of these tips, however, Ellen, leads us to a really important question that I think I get asked every day. Do I have the permission to talk about my care recipient to the provider? Do I have the right of making decisions on behalf of the care recipient?
Actually, Rita, there is a question in the chat that I think might be important for both you and I to look at. It says, what are the advantages to having an actual diagnosis? That once you hit 60, you're already on the dementia spectrum. And so I would disagree that people are going to be on the dementia spectrum once they hit 60. And there are so many things that can actually cause possible confusion or impaired judgment that I think it would be good to know if you're dealing with something that's reversible or something that's progressive. Paula mentioned some of the videos by Teepa Snow, who I think her videos are amazing. She does a lot of work on dementia care. Some of them are free videos, some of them are actually she charges for, and then Tia Powell's book as well. But there are advantages in terms of accessing resources if you clearly have dementia, but also making sure you don't have something reversible that could cause some impaired judgment and memory problems. And I don't know what you think, Rita, about that.
No, I completely agree with you. I think that's absolutely right. And I thank you, Paula, for sharing that link.
And now next slide, please. So we wanted to make sure we included some information on caregiver decision-making and informed consent and what capacity means. Some of these questions have come up on earlier talks, and we thought this would be important information. Informed consent is a written document signed by the care recipient, placed in their medical record, and it gives permission for medical information to be shared with their family, caregivers. It's completed before dementia impairs their ability to understand this, and it doesn't need the involvement of a lawyer or a doctor. But I want to distinguish between cognitive capacity and competency and capacity. Sometimes those words are used interchangeably and they're very different. Competency is a legal determination of global decision-making. It may involve finances, property, wills, and it's determined by a judge in court. Capacity is a clinical determination about a specific decision, and that can be made by any clinician familiar with a patient's situation. There are 4 key components when a clinician does a capacity evaluation. Does the person demonstrate understanding of the situation? Do they appreciate the consequences of their decision? Are they able to reason about the risks and benefits of a treatment option and then come to a decision that's in line with their values and best interests? And finally, can they communicate their treatment choice? A lack of capacity, it refers to the inability to make decisions about a proposed medical treatment. But capacity is not all or nothing. Someone may have cognitive impairment, but still have capacity for a specific decision. Someone may have capacity to make a small, straightforward decision about whether to start a new medication, but not have the capacity of whether to consent to high-risk surgery. They may not be able to fully understand it. And of course, acting against medical advice does not mean that someone lacks capacity. In my experience, that's sometimes when doctors inpatient order capacity evaluations because the patient isn't following their advice. But that does not mean that someone lacks capacity. These are some sample questions that are involved in capacity decision-making during a capacity evaluation. And these, a clinician may ask a care recipient, your care recipient, these questions at the bedside. Simply, what is your understanding of your situation? Or tell me what you think your options are. Or what is your understanding of the benefits and risks of this procedure? What is your understanding of what will happen if we do nothing? And there are various tools. A lot of times these capacity evaluations occur at the bedside, are part of a regular conversation. But if the clinician isn't sure, there are tools to help determine capacity if you can't simply do it on the basis of conversation.
Ellen, those are such important points to remember. And I, remember being bedside in the inpatient Stanford Hospital and talking about these aspects of understanding, appreciate, reason, and communicate. So those are really, really important tips. I'm reminded of a family that I'm working with, and this would be a great case study to discuss. And in a meeting with the daughter, who's the primary caregiver, the care recipient, and the health provider, the care recipient absolutely refused to take any of her prescribed medications ongoing, stating, "I never liked taking medications." Now, these are important medications, recently prescribed, and mainly for mood and cholesterol. The daughter, in this case, has the durable power of attorney for health and finance. What would you recommend, Ellen?
Rita, it's important to see if the patient is able to understand why the medicines were prescribed and what their potential benefits and risks are, and what might happen if she refuses and doesn't take them. Is it just a simple refusal to not take any medications, or is there some understanding of her condition and appreciation of the situation? If it is determined by the health provider that the care recipient lacks capacity to understand the situation, then the caregiver may proceed and feel okay about providing the medications. However, if the care recipient does have capacity, we need to honor their decision, even if the daughter doesn't agree and doesn't feel it's the best decision. I've said many times, people have free will and the right to make bad decisions as long as they understand the situation.
Mm-hmm. Thank you. That's a really good perspective to keep in mind. Now, caregivers are also really concerned about the financial, the medical aspects of care. As I mentioned, in this case, the daughter is the durable power of attorney. And to do that, to create a durable power of attorney, you do not need a lawyer. But if the care becomes complex and the care recipient needs extensive monitoring and managing, then a conservatorship or a guardianship, you do need 2 letters from doctors and legal help. Ellen, many times families, like to go to geriatric care managers who can guide them through various aspects of this really arduous journey. There is paperwork, there's proactive planning, there is all that work that needs to happen after diagnosis, facilitated conversations with doctors and psychologists, seeking those behavioral and medical interventions, and even setting up a daily structure. The reason why I think, Ellen, you and I are going into this in greater detail is that this syndrome is really like no other, and it needs what I think a multifaceted approach. But if you start with that approach, the roadmap becomes somewhat easier. Don't you agree, Ellen?
Definitely. I think there's a lot of thought and a lot of planning, and then knowing that there are people out there who can help you with these type of evaluations. I think Paula has provided some information in the chat as well. But we are going to move on and start the final section of our talk that addresses risk factors for brain health, along with the latest info on how to preserve brain health. But for the longest time, Rita, everyone's focus was on heart health. But today, brain health is constantly in the news. Study shows that mental well-being is related to better brain health. And it can even reduce the risk of dementia and cognitive decline later in life. Next slide, please.
Ellen and I really love this slide, just a big picture perspective, and just to think about brain health. Ellen, you're so right. I mean, I have spent 25, 28 years of my life in an inpatient setting, and I remember that it just probably in the last few years, that brain health and cognitive health is constantly talked about. So what exactly is brain health? The areas, because listed on the slide, tell us exactly the definition of brain health. It's just not the absence of dementia. The brain is now being tested and studied nationally and globally for the preservation of optimal brain and cognitive function and the absence of overt neurological disorders. That's what the focus is on right now. You cannot turn a page or go on the internet without reading about this. While some factors affecting brain health cannot be changed, there are many lifestyle changes that might make a difference.
And Rita, we're going to talk about a lot of the lifestyle changes coming up, but brain health can also certainly be affected by age-related changes in the brain. Injuries such as stroke, traumatic brain injury, mood disorders such as depression, substance use disorders or addictions, and certainly diseases such as Alzheimer's disease. Next slide, please. The Global Council on Brain Health developed this, oops, I think we're off one.
Kat, could you move the slide to the next one, please?
I think Rita was taught, yes. So this was, sorry.
I don't know if you can see the slide, but yeah, go ahead.
I think this is a great image. This was developed by the Global Council on Brain Health. And this is a really easy, interesting reminder on things you can do to really preserve and strengthen brain health. Many people find it useful to keep this handy and refer to it in their daily life. Under vascular risk is managing blood pressure, reducing salt, other metabolic diseases, reducing alcohol, it's on here, adhering to medications, quitting smoking. a whole range of activities that you can be focusing on.
And, Ellen, if any of our viewers like this slide, we are happy to provide this, because I have this on my desk and I give it to everybody I meet, because it's good not only for caregivers, but for care recipients at any stage of life. Being physically active, even walking 30 minutes, it's an excellent way to promote heart and brain health. Stimulating the brain. I mean, we talk about this on a daily basis. Daily investments in informational sessions, volunteering, learning, going for book clubs, even if it's on Zoom, staying mentally active, dancing, learning something new, connecting with others. And these have shown changes in empirical research studies. Remember, it is almost, if you force yourself to do these, you find getting more and more involved, and it actually helps and boosts brain power. We can all invest in this, and probably most of us are.
Rita, one of the things I like to focus on, and that became particularly hard during the pandemic, was social engagement. Recognizing that you're becoming isolated and addressing loneliness is very important. And we are going to talk a little bit about some creative ways people came about how to recognize this and how to deal with it during the pandemic. We're just starting to emerge from sort of imposed social isolation. But we certainly could have a whole talk on diets and nutrition, whether it's complex carbs or fatty acids or the Mediterranean diet, lean proteins. There are so many great resources out there on diets that we're not going to go into depth during this talk. Neurologists have also noted for the longest time the importance of sleep on brain health. Next slide, please. So another resource in terms of brain health is the American Heart Association's of Life Simple 7. But before I start that, I do want to say the last slide, a picture is worth 1,000 words. And so as Rita said, we can make that picture available if you find it helpful. Because I love a visual reminder of tips for brain health. But the American Heart Association did come up with a similar list of Life Simple 7. And this, 2021. Some of these we've mentioned before about managing blood pressure, healthy cholesterol levels, reducing blood sugar. We want, increasing physical activity that Rita mentioned, eating better, losing weight, and not smoking.
And the other 6, again, Ellen, that we're constantly, hearing about in studies, in research studies, as well as in universities, is depression, social isolation, excessive alcohol use, as you said, sleep disorders, less education, which really goes to talk about learning on a daily basis, understanding what's around you, hearing loss. So we have seen, unfortunately, the impact of the massive social isolation imposed by COVID-19. And all of you are aware that the CDC specified that social isolation was one of the worst risk factors for all adults, but especially for older adults, for mental health. And many, many of us, whether we are caregivers or care recipients, we have suffered from social isolation. Next slide, please.
The American Journal of Geriatrics found that the impact of social isolation and loneliness on the health and longevity of older adults was huge. They reported that social isolation and loneliness was associated with a 50% increased risk of developing dementia in older adults and a 26% increased risk of simple all-cause mortality. Surveys early in the pandemic showed significant stress and isolation for caregivers of loved ones living with dementia or MCI, or mild cognitive impairment. 88% of these caregivers had one or more symptom of stress: sleep problems, difficulty concentrating, loss of interest in activities, irritability, or angry behavior. Overall, there was increased stress, increased anxiety, increased loneliness, and many people wanting support groups, but not always finding them. Next slide, please.
So, I am so impressed by what I have seen, Ellen, in our community, nationally, even globally, in the fact that we are fighting this terrible pandemic, but the ways that communities have come together in terms of creativity, in creating structure and trying to dispel social isolation. And I think everybody in the audience, I'm sure you have created your own opportunities, but technology, innovation, these have become really important in helping us reduce social isolation. And another thing which I have done in my own practice, and I think, Ellen, you would agree with me, is encouraging people to create that structure. I'm working with someone and we've been able to create a structure by, again, a very supportive environment, using technology, having her dance, having the care recipient sing, being part of some engagement, some activities, even walking in the backyard. So all of these go towards helping isolation. Ellen?
Rita, there were some fascinating ideas that worked for caregivers and care recipients during the pandemic. And I want to just mention a few. Some of these were not local, but they were interesting and certainly could be developed locally as well. Engaged, and that's ENGAGED, and it's listed in our resource packet, is an online resource for older adults. And it has a directory of innovative programs developed since the onset of the pandemic. They ranged from check-in calls from nursing students to pen pal services and letter writing campaigns, robotic pets, weekly online choir rehearsals for patients with early stage memory loss. And these were structured choir rehearsals for caregivers and care recipients to sing familiar songs. As Rita mentioned, exercise programs done via Zoom. Many communities had local police officers checking in to frail older adults every morning. There were volunteers paired with socially distanced older adults to do porch visits, certainly assisting with grocery delivery, but making some type of contact. And certainly there are many more that were available all over the country, and interesting to see what's worked for many communities.
And I think, Ellen, the reason to share all this is that in this creativity, in this moment of innovation is where we are right now, because so many facilities have suffered so many losses. But I think we are coming, and the task forces we are on, we are really looking at this with a new lens to see how do we create some of these aspects within our daily lives of reducing isolation, because that has such a great impact. So in summary, Ellen, caregivers are, we applaud our caregivers. They need to be integrated into the health system. Remember, we spoke about the unit of care, that the caregiver always needs to be included, and you must advocate for that. You need information on care recipient illness, symptoms, progression, referral to support services, having that sense of optimism that there is a big picture approach that you can move forward. Ellen, you and I have recognized the huge emotional and economic impact this disease has had on caregivers. And once again, we applaud them. Before we end though, the news about the new drug aducanumab is everywhere globally. You and I have heard so many reports, we've been on so many calls, and I think it is important to talk about it. Next slide, please.
Before I even start talking about aducanumab, I want to recognize there is an important need for safe treatment for Alzheimer's. And people who are suffering with Alzheimer's, family members, are clamoring for some type of therapy. And that's the setting where where aducanumab was approved by the FDA. It received accelerated approval from the FDA for the treatment of Alzheimer's, which means that it really has not shown clinical improvement yet. It's a monoclonal antibody. It's intended to slow the cognitive decline by reducing beta amyloid in the brain. And it was shown to reduce the beta amyloid in the brain. However, there have been other drugs that have also reduced the beta amyloid in the brain and have not yielded any clinical significance or improvement in patients. And there really was not clinically significant improvement shown in the 2 studies that they did. Initially, it didn't get approved, but then it did receive this accelerated approval just earlier this month. It costs $56,000 a year. It involves an IV infusion every 4 weeks. And a PET scan is needed before starting the drug to document that there is beta amyloid present. And then follow-up MRIs are also required. There is some fear that it could bankrupt Medicare with the cost, and that what will the trade-off be? Will Medicare stop paying for other things if they need to pay for this? Because there is widespread interest. And so what basically, given that there, we know that it does reduce the beta amyloid. We don't know that if it will provide any clinical improvement. The company that makes it is recommending that, it will need to do later clinical studies to demonstrate some clinical improvement. And we advise you to speak to your own physician about this. There is certainly a lot of hope and interest, but a lot of uncertainty. And
I think, Ellen, that was an excellent summary, because you and I are inundated by calls, and that's such a great idea to be able to sit down and talk with the health provider and discuss all of these aspects. So I think we are at the end of our talk, and really we want to just step back and talk about the fact that this is an important place we are at in terms of research and what we move forward. As Ellen said, there is hope. We are hoping for more and more interventions and other breakthroughs coming through. But at the end, the caregivers who are managing this syndrome day in and day out, one has to really work in terms of looking at the big picture, the whole, creating a customized plan. And once again, Ellen and I are happy to answer any specific questions that could be, sent to us on a private line or on a private email. Thank you so much. Paula.
Okay, we're going to start our Q&A, and I see a first one. What is informed consent again? If you can explain what informed consent means for the caregiver, whether it's just signing on the medical records and you have informed consent, and how does it differ from a legal right to make decisions for a patient? I think that's where people get confused.
Okay, so informed consent is not, well, there's, on one hand, anytime somebody agrees to a procedure, they're giving their physician informed consent, and the physician needs to make sure they have the capacity to understand, and they give informed consent. I think informed consent that people can give to allow their loved ones access to their medical records does not require a lawyer. It's basically signing, you're giving permission and access to your health record. That's different from a legal determination or on whether somebody doesn't have the ability to handle their finances, or that's something much further down the road. Informed consent is done when the person still has the ability to give permission to a family member for access to their record. I don't usually get involved in informed consent. I'm usually involved more in the capacity determinations, whether people, and inform in order to make sure that somebody has capacity before they can give informed consent to a procedure, to a test, to something like that. So it's a much more recent information that allow more access and help in sharing of medical information.
Okay. Someone did ask for you to repeat the contact information for Engage.
And I think it's in the handout you're providing them. The link is actually there. So
Yeah.
if they just
Right.
click on that link, it'll take them directly to that page.
Okay, just so everybody knows, you are going to be receiving a very detailed, comprehensive handout from this session that Rita and Ellen have actually worked on, and I've seen it. And it was one we started a few years back, but they've expanded on it for dementia caregivers. It's a gem. So just be on the lookout for it. It's going to come in your email. All right. So let's see. Are there other questions folks have about dementia, brain health? This is a time now for sending in your questions, because this is a very valuable moment to be able to ask questions directly of Dr. Ellen Brown and Dr. Rita Ghatak. So we encourage you to send questions. If not,
But you know what, I can put the resource in. I mean, I have,
sure.
I do have I'm just trying to get it to, so I can get it to everyone. There it was. Okay.
Sure.
I just have it available, so I'm happy to do that.
Okay. I had a question. I posted it. So, and I also received this in my caregiver group, because my caregivers give each other tips, and I have to be careful when I feel that, I know one person's situation doesn't necessarily relate to the others. So how do people judge information online? That's become very complicated. How to judge, especially about health, dementia, medications, where to go for what? Any guidelines for that?
I mean, I think there is so much misinformation that is online that I highly recommend people discussing new treatments, new tips, discussing it. If it's a medical treatment, discussing it with the health provider. If it is, certainly if something comes from a reputable source like the Alzheimer's Association, the Family Caregiver Alliance, I tend to value their their advice is good and sound, but it really depends on the source of the information. I mean, the Stanford's Alzheimer's Center, again, has reputable information. I think, as you mentioned, Paula, everyone's situation is different. Support groups are helpful to hear what ideas have worked, but you don't know if it's going to work for your loved one. And so discussing it with a health provider is always going to be helpful information.
Okay, I just want to let everyone know that actually you're going to receive a copy of the video, and it's going to be posted on the Avenidas website. And I just put that in the chat line. So any of the individual slides that you see that you find helpful, you're welcome to, as you run the video, I actually will photograph a slide if I find it is something that for me is a guideline and I find it very helpful. And I think you have permission to do that with our videos. That's fine. Okay, so we're starting to get some personal questions. And I just want to say that as we read these questions and answer them, if some of them are a little too personal, we may ask you to contact us directly, but we'll see if we can give an answer if it's a personal question in a general way that would be helpful to everyone. So here's a very common question we are asked, that how do you communicate with an early stage patient who thinks he or she is still very capable and insists on going out alone or is resistant to going to the doctor? There are many, many things that during the early stage folks do want to do. So tips about that.
So I think this is something that I'm so glad, Paula, somebody asked, because to me, this is probably the most standard interaction I have, where somebody has been diagnosed with MCI, mild cognitive impairment, and the only reason that diagnosis actually happened is because the family members or the work environment started noticing some things. Now, as you know, mild cognitive impairment really is memory is impacted, and maybe another aspect like maybe delayed decision making or inability to carry out a specific task or some logic or others. It is so different, because I could sit here for the whole day and give you case study after case study where individuals who are really functional, doing well, and do have MCI, but just don't recognize some of the deficits, some of the areas where they're probably, they want to drive it, it's not the best thing to do, or they're doing some other things. And I think it's such a delicate balance. So what I typically do is we sit down with the caregiver and we try to analyze what exactly is the area that is really being impacted. And I could give you a couple of examples. I mean, in one particular case where this individual with MCI is making some questionable financial decisions. And so it is a really, I'm not going to say it's easy, it's a very hard area to balance because you want to keep the dignity, the respect, and the attention and the love for the care recipient, whether it's a parent or a spouse, but yet you're recognizing these. So sometimes conversations, with the physician or the health provider and everybody else to talk about these things is important. Sometimes it is important to take it one step further and see what these questionable decisions are. Should it move towards a durable power of attorney? But it is not easy, Ellen. I'm sorry, it is not easy, Paula. So I think these are the times where we do recommend family meetings, in-depth discussions so that you get that perspective. Ellen, do you have anything to add? Because
Yeah, no, I mean, the only thing I would say is the hard part is balancing safety with
Right.
autonomy. And in the early stages, I think sometimes it's hard. On one hand, there's fear. There's fear that something's going to happen. And how do you allow for the most possible freedom and independence, but yet have some kind of boundaries? And the family meetings are really good because I think it also gets the fear out in the open, a sense of how much is the person truly capable of, how much can they do, how can you modify the environment to allow them, the need to get outside and do things, but to do it in a way that's that is safer. And it's a balancing act.
Right.
I think there's no one answer for everyone, but getting everyone to at least be open, bring it out and discuss it can really be helpful and move at least somewhere down the path.
And I think, and I think, Ellen, it's just because of what you said, because I have actually walked this path myself with my own loved ones, is that this is the reason why caregivers need this level of support, need this level of clarity or information to how to make, as you said, balancing the safety and the autonomy and how to move forward. Go ahead, Paula.
There is on the Family Caregiver Alliance under their tips and articles section. So Google Family Caregiver Alliance tips and articles. There's a very specific article on how to caregivers cope with a loved one who is resistant to suggestions, seeing a doctor, all of that. But I want to just offer a thought that joining a caregiver support group is a great place to practice role modeling and questioning and asking your peers how they're handling a specific situation regarding this. So for instance, we just talked about in my caregiver group on Monday, somebody who's early stage but still driving. And the driving issue is perhaps the most dramatic and profound about managing risk and safety, because the risk involves the person driving, the person in the car, your neighbors, the local community, and also your financial resources if something should happen and there's a diagnosis in the client's chart that they've been diagnosed with Alzheimer's or dementia, and whether or not it's early stage at that point in time. If there's an event and an accident, the early stage part it's not going to be as relevant to the family who suffered the injury, who will let the insurance companies pay off, but then might continue in some other kind of legal action against the driver and that family. So that is a topic I've talked to my caregivers about a lot, and we've run actual separate forums on driving, and I'll do those again. But if this is an issue that you're dealing with, call me, because I've actually met with the DMV and the representative in Oakland who handles issues regarding older adult drivers. And I just have developed a lot of knowledge about this area. So you can contact me separately if this is something that's very specific to you. Now, Ginny asked us a question about her husband who was diagnosed a while back with MCI, but has never been assessed further. And he's developing, it looks like, mobility issues, jerking, his walking is weakening, and his memory down to a couple of minutes. So she's asked whether or not she should continue with the primary or should she take him to see a neurologist? That's her question.
Go ahead, Ellen.
You know, I hate to get involved in
Mhm.
individual decisions. I think if about specific patients, that's really not our role here. But I think if she has concerns, she can certainly see a neurologist and get an evaluation. Certainly might provide some helpful information.
I think, yeah, the clients in my caregiver groups are very confused about when to move from the primary to a neurologist or a dietitian or something specific. So you always start with your primary and you ask for the referral to
And
the
most people with
situation.
dementia do not need to see a neurologist. Most,
Mhm.
you know, I am biased towards geriatricians because
Mhm.
they specialize in the study of people who are older and dealing with progressive neurologic diseases, as well as usually know the resources in the community, the social services in the community. It's when there's things that when you're not getting the answers or when things are progressing or when things out of the ordinary, a neurologist might be helpful. But neurologists are certainly not able to see every single patient with dementia, and it's certainly not needed for a diagnosis.
I think the question is in her case that it's not a geriatrician, it's the doctor, that it's primary. So I've met so many of my clients who still are not with geriatricians, but have family primaries they've had for years.
Yeah.
And so that's why some of these symptoms are not always responded to in the way that if they were seeing a geriatrician or a neurologist, they might.
Well, you know, it's
benefit.
unfortunate. When I trained as a geriatrician long time ago, the thought was that every primary care provider would have basic geriatric knowledge, that we would do such a good job that you wouldn't need there to be as many geriatricians because we would be training all the primary care providers to know how to handle these issues. Unfortunately, that didn't happen. But
Yeah,
yeah.
I agree with both Paula, you and Ellen, and I think that I have personally accompanied a caregiver and a care recipient to a primary care physician just because to make sure that all the questions, and I think we go back to our earlier days of there's just a little bit of time and there's not enough time. So to be able to write down those specifics, like is it appetite, is it sleep, is it a specific, as you said, mobility, what exactly? Are there any other comorbidities that are forming? So I think it's really important. It's about figuring out what is affecting what. And, you know, I mean, I could go on and on when we try to assess what's happening within a day and what one particular vulnerability can lead to another vulnerability. So again, echoing what Ellen is saying, having a list of questions, maybe preparing ourselves a bit better, but you can always have a special geriatric consult. You can have a neurology consult, a psychiatric consult, if there are specifics to it. And we are constantly working on these. So if there are any special questions which are at a personal level, we can definitely handle those, or you can handle it, Paula.
Here's a question. Are there any games, books, or videos that you would recommend to help interact and engage with dementia patients?
So
there is so many.
Yeah, I was just I had seen that question and was coming up with an answer. Again, it depends on the stage of dementia. For more advanced dementia, I really like Tifa Snow's videos. Mm-hmm. She has very helpful suggestions. She focuses on how people with advanced dementia often have visual and spatial changes. And so how to approach someone so that they don't startle and react, how to use music, how to transfer, and it's very hands-on. So I like her videos for advanced dementia. I like her approach on working with people who are dealing with dementia. But Rita, what were ones you were going to suggest?
No, I think exactly what you said. Those are there. And then was the question about specific videos and games? Is that what it was? Again, I always start, Ellen, by saying that what will work, because sometimes overwhelming somebody I have seen has an opposite reaction. But if there are, you know, simple things that they have liked in the past, you know, even a walk, even a simple, you know, an iPad game, and some of these, again, it all depends on who we are dealing with. and what exactly is their baseline, what are the triggers, what are the time of the day. So we need to spend a little time in understanding some of these, but I do love those videos as well.
We have a question about if there's a decrease in a person's appetite, how would we work with that? And because so many people gravitate towards sugary products, how does the dementia caregiver deal with that type of behavior? It's a great question. Yeah.
It is a great question. It's, what happens a lot, it's funny, way back when I was a fellow, I actually did a study on elderly veterans who were malnourished. And one way to get them to eat was to give them sweets, to encourage them to start eating again. But the danger is if that's all that they're going to eat. Again, it depends on the stage of dementia. At some point, you can't force someone to eat. You can try to provide foods that are varied, disguise foods that are varied. But at the end of the day, and there are many nutritionists who will work on providing meals that are tasty, that are easy to chew, that are finger foods, but that are healthy finger foods. But you can't. It is a known issue that people gravitate to sweet foods, especially when they're already malnourished. Rita, what do you offer?
Yeah, I agree. I agree exactly with what you said.
I would also like to just suggest folks investigate your local area adult day healthcare center, because they will provide you as a caregiver with respite and a day full of program and great activities for folks with dementia, and which is going to decrease their social isolation. And you're welcome to call our adult day health center, the Rose Kleiner Center. It's listed on our website. And it's going to have an open house August 28th. And you can go there, meet the staff, and learn about their activities and also their vaccination and masking protocols.
Yeah, I can't
now state of the art
enough. I think those are fabulous programs.
Yes.
For one, providing respite for caregivers, but the socialization, the activities that they can get physical therapy there. The therapies, they're fabulous programs. And unfortunately, because of COVID, they've been closed. But the fact that Rose Kleiner is opening up, that programs are opening up, will go a long way. They provide a meal. I mean, that is, so many areas that get addressed.
And on our website, the staff at Rose Kleiner have posted, I think there's a video and links to activities that you can do as a caregiver with your person who has dementia. I believe that is on our website too. So here's another question, and I hope I read this correctly. Any caregivers day conventions with respite for our dementia relative coming up?
I don't understand that question, Paula.
That is the way it's worded. I think they're looking for something like a place for their person who has dementia to go for the day.
Mm-hmm.
To give the family respite. And again, that would be an adult day health center, but those usually you join and you belong to. So I'm not aware of anything that would be just available for the day.
I thought the question was, is like a caregiver conference coming up where the caregiver can go to the conference and then there's respite for the family member. That's how I read it, but I don't know. I could be wrong.
I think she said yes. That's what she meant.
Okay, great. So so the Cure Forum series is going to continue as is by Zoom through October, and our agency does each year provide an annual caregiver conference, and there are many in this area. And so the question always becomes, will there be respite for the person with dementia or care for that while the conference is going on? So that's something we're going to look at again for this coming year. And sometimes the home care agencies will contact us and offer free caregiver coverage for your person while our conference is going on. So that's a great question. So stay tuned for that, because I hope we can come up with something like that for our conference.
And I just saw a question, Paula, about the transportation to health, I don't think they provide.
You.
They do, because in the beginning they used to, but now it's
Oh,
the
because-
caregiver has to be dropped by, and I think that's probably going to continue for at least a few months, but it may change, yes. But initially they used to do that.
They used
Yeah.
to do it. I don't know if they're going to plan to resume, when they plan to resume
When
that.
they plan to resume.
I can tell you in general that the Avenidas door-to-door program is rebooted. And again, on the website, find Avenidas door-to-door, and you can read about our transportation services, which are now going to include at some point a driver who can escort your person who's more than less functional to an appointment and be there with them. So we are making changes here as we are talking today. All of this is still being thought out, which is why we're having a slow return, because we are trying to meet the needs of a local community. So just read about door-to-door, find the phone number on the website and call them, and the folks will share with you the updated services.
So before we end, Paula, there's something I wanted to say, and I know Ellen and I have discussed this. One of the reasons we talked about self-assessment, because this is something that, you know, I have experienced in my personal life about trying to assess my own caregiver burden or stress levels. So for example, the Zarit burden scale that we are providing today, and another, I'm sorry, I'm jumping, but somebody asked about that template of those picture. We can also send that as a separate slide. But coming back to self-assessment, it is important to know where we stand as caregivers. How much can we do? What is in front of us? And I think that does help us make some good decisions, that there are some things we can control, there are some things we cannot, and where to get the help, where to seek that out and create that plan. So I think from that perspective, to be able to look at all these resources in front of us, like the adult day health, any other, I remember we used to have those where we had friendly visitors, or where we could, you know, have some of those solutions. But overall, it's again going back to just giving ourselves a break as well, and saying, this is what we can do, this is what I cannot do, and how much do we really understand that. So I wanted to say that before we end.
Thank you.
Thank you. This has been so helpful for all of us. I think your entire presentation lends itself to what I'm now thinking of as an incredible option and opportunity and possibility that we never talked about, which is what I'm calling successful caregiving. That each day, whatever your goals are, small or large, if you get 3 of them, 2 of them, 1 of them accomplished, you have had a successful day of caregiving, and that you deserve to give yourself during that day
Exactly.
some sort of respite, whether it's that 10-minute walk, that ice cream, whatever it is, to give yourself a bit of relief and acknowledgement, because what all of you are doing is extremely hard work and a labor of love. And we all know this. And that's kind of why all of us have made our careers doing this, because we are just so motivated each time to the people we meet. Now, each one of us have been working in this field over 20 years. And I want to say safely that, and I think this is how my colleagues are feeling, we're really not burnt out. We're very motivated every time we meet with our clients to just learn from you and keep going and keep sharing and just trying to keep our community engaged with your full life. You know, you are a person who is caregiving. Caregiving is not your full identity. We're here to help you with it, but we want you to engage with your full life.
Very well said. Very well said.
Okay.
Okay.
So thank you,
Thank you, everybody. Mhm.
And keep in touch with us. And we're sending you a buttload of information. You're going to be getting handouts, surveys, and the video.
Thank you, everybody. Thank you again.
Thank you, Kat, so much.